Quickly for that wonderful report. Now, away from that, today marks the opening of the 11th Annual Adolescent Health Conference in Kampala, Uganda, an event bringing together medical experts, researchers, and advocates to tackle pressing issues of health challenges facing Uganda's youth. And the theme, Adolescent Health Fostering Wellness Through Collaborations, and the conference has spotlighted critical issues affecting adolescents across the country, Uganda. Just take a look. From mental health to HIV testing, teenage pregnancy to long COVID, day one of the conference has been a deep dive into realities confronting Uganda's adolescents.
In Kigali, because the plane.
Clinical psychologist Juliet Bichulu opened the day with a sobering reminder, saying adolescents are grappling with psychological distress, including depression, substance abuse, addiction, and suicidal thoughts. She urged parents to stay engaged with their children even when they are away at school, and emphasized that academic pressure is a growing burden.
We need to work together. It's not just a school counselor. You need all. You need to work with the school, work with psychologists, work with counselors.
Dr. Joseph Lujumbai, senior lecturer at Makerere University, highlighted the impact of free adolescent clinics that have served nearly 3,000 individuals since 2013. He introduced the HAID Psychosocial assessment model, focusing on home, education, activities, drugs, and sexuality. However, he raised a critical question of where the boys.
Of the adolescents we have seen, 77%. Are females, and again this speaks to where is the boy child, why are they few, and as we think through, we need to identify strategies of how do we reach both the boy, the male and the female adolescent.
Now, Dr. Moraic Kellob, a medical intern at Ginger Referral Hospital, shared results from a survey in northern Uganda where he found that adolescent girls and young women are underrepresented in HIV testing, despite contributing 25% of new cases. Many cited barriers like lack of access to testing kits and difficulty interpreting results.
Actually, in our study, we saw that only 23% of the people had of those adolescent girls and young women, only 23 had the secondary or higher level of education. That means more than 70% of all the adolescents we interviewed had the either primary or no education at all. So that really tells you that there is actually knowledge gap.
Now, Dr. Mirembe Damali turned the spotlight on teenage pregnancy, especially among young men. Her survey revealed that the rate has stagnated at 25% for 2 decades. Alarmingly, many young men lack knowledge about contraceptive use and were unprepared for fatherhood responsibilities.
Most of them were scared of being young fathers. So when we conducted the study, actually, we found that 45.8%, that is almost 46% of the young men, had ever impregnated a teenage girl, and that is a very high rate. It was higher than all the previous studies done in sub-Saharan Africa, and also higher than other studies done globally. And of those that impregnated the young girls, 35.8%, that is 36%, reported that they actually coerced the young girls to abort.
Dr. Melissa Stockwell, Chief of Pediatrics and Population Health, addressed the lingering effects of long COVID among adolescents, noting that many are still struggling with the symptoms years after infection.
But there's a group of people, about maybe 10 to 20%, who have prolonged symptoms after a COVID infection. And for some people, those are symptoms that continue from the original infection, say extreme fatigue. But for many others, they actually get better from the infection and then a couple of months later start to have new symptoms. And those symptoms, that can happen after an infection that's a mild infection, or it could be from a severe infection, or even from an asymptomatic infection, meaning a infection where there are no symptoms.
Now, Dr. Alan Kasozi from the Ministry of Health assured attendees that the ministry will use the data and recommendations from these surveys to improve adolescent health policies and services.
We've gotten to know that 46% of all girls between the ages of 15 to 19 are already having sex. But even in as much as they're having sex, they are actually not privy to the complications or after effects of having sex, like STIs and teenage pregnancies. We've also gotten to understand the increasing importance of working with academia, researchers, and other players to improve adolescent health and well-being.
Closing the day, Dr. Sabrina Kiteka, pediatrician and president of the Society of Adolescent Health in Uganda, praised the success of the first day and called on parents and communities to join hands in supporting adolescent wellness.
Each of us has a role to play, but also to the parents. My call is to the parents. It starts with you. You are the first point of care for our children. You're the ones who will support them with information, with guidance, with care, with making sure that they're vaccinated. And as we continue the conference, tomorrow we have other exciting presentations. So please come back and listen.
The conference continues tomorrow with global speakers and collaborative sessions aimed at shaping a healthier future for Uganda's health.
Working and we're going to fly.
Freddie Chris Kisao, BTM News Today. Now, as the conversation deepens, one thing is clear, that adolescence is not just a medical